Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. Happy to have you here. I'm Reed Price. I'm the director of the center. Today we have Jason Doty and we have Jessica Guidry with us. Jessica is from the Kitsap Public Health Department, and Jason is with Kitsap Aging and Long-Term Care, and we're going to be talking about loneliness and isolation and how we can work together to combat that epidemic. Before we do that, though, I would like to acknowledge that we are meeting on the ancestral homeland of the Puget Sound Coast Salish people, the Suquamish tribe. The people of the Clear Saltwater are our nearby neighbors. We honor them and we are learning from their stewardship of these lands and waters since time immemorial. Also, I'd like to thank the folks at Fieldstone Communities of Bainbridge Island, which offers independent and assisted living and memory care up on Rolling Bay. They have respite care and day stay programs, and if you'd like to take a tour, they'd be glad to treat you to lunch or dinner as part of that. Call Celia or Jamie at 206-594-1010. Their website is fieldstonecommunities.com. So I noticed in the paper, I guess, a little bit about a get-together of a number of organizations as a workshop to try to kind of be aware of each other's work on loneliness and isolation. And obviously, that's one of the things that that is a challenge, especially as we get older and lose connections with people, though it can happen at any age. Jessica, I wonder if you might be able to just tell us a little bit about the inspiration behind the workshop to get the conversation started today.
Sure. Thank you, Reed. And thank you so much for the invitation to join you today. So the idea for this workshop actually came up last year. The health district, along with the county and Virginia Mason Franciscan Health, held a maternal infant health forum. That was in response to the State Department of Health, Washington State Department of Health. They released a maternal morbidity and mortality report for the state. And one big issue that came from that was maternal mental health. So the health district, along with the county, Virginia Mason Franciscan Health, and Kitsap Mental Health Services, started talking about, well, what does it look like for us to have a mental health forum in Kitsap County? And mental health is very broad. So we were tossing around some ideas, and the idea of social isolation came up. And we like that idea so much for a number of reasons. One is it affects, you alluded to it earlier, Reed, folks of just different ages, different backgrounds, regardless of income. Folks experience isolation and loneliness. And the U.S. Surgeon General about 2 years ago released a report declaring social isolation and loneliness an epidemic. And the report is quite excellent. I don't know if you've had a chance to read it, but it talks about how we as a community, as a nation, can address social isolation and loneliness. And part of that is really promoting social connection. So what we did, so with these organizations, the county, the health district, Virginia Mason Franciscan Health, and Kitsap Mental Health Services, we held a workshop. And this was on September 24th. It was at the fairgrounds, and it was called you think I remember the title of it, considering how many months we worked on it, but really it was about enhancing our social connection and addressing social isolation and loneliness and epidemic. And we really wanted this to be a strengths-based approach. So we didn't call it the social loneliness or isolation event. We really wanted to focus on addressing social connection. So we had a speaker from an organization called Healthy Places by Design, and her name is Risa Wilkerson, and she's the director. And she's been involved in several events that promote social connection. And so what she first did was provide us with a presentation to give us the context of why addressing social connection matters. The fact that it affects our physiology. So when we think about how when you're lonely, it can affect your stress hormones, inflammation. It also addresses, can cause stress, depression, can also lead to unhealthy behaviors like over-consuming substances, for example, and how that affects your health. But it also affects our economy It affects how we work together. It affects so many aspects of our society. It is not just a mental health issue. It is a health issue. It is an economic issue. It is a cultural issue. And she also laid out in terms of how can we address it in terms of, yes, well, while we definitely talking to our neighbor really makes a difference and doing that one-on-one connection, but then within our communities, we also need to address social connection within our institutions, so in my workplace, we address social connection through our workforce wellness program, talking to colleagues, for example. In our schools, we address it. And in our community, like the Bainbridge Island Senior Center. So there's so many aspects of how we address loneliness, and we have to address them all. So she provided us with this context in the work in a presentation. And then she led us through a workshop where we had conversation. Because the idea for this workshop, it wasn't just meant to be, I'm going to talk and you all are going to listen. It was, okay, by the end of this event, these organizations who participate are going to come out with solutions that they can address and that they can act upon. And that's one thing I forgot to mention, Reed, is that this was an event for organizations with the idea that mental health and social connection is not just an issue that mental health providers need to address. We all need to address it. So we had organizations, we had housing organizations, we had long-term care, we had healthcare, we had education, we had other nonprofits, we had a faith-based organization. So the idea that everyone can contribute. So in the workshop part of it, we were asked, what community assets do we have in Kitsap County that address loneliness, coming at it from a strengths-based approach. And we had a lot of feedback on what we have going for us really well in Kitsap County. Then we talked about, and we were asked to talk about what prevents us, what are the barriers to social connection? And we gave our responses, and we actually had an online survey called Mentimeter, and we got to see our responses in real time, and they were placed in a word cloud, and it was wonderful. In terms of our assets, there were things like parks and libraries, senior centers. In terms of barriers, transportation, and I know on Bainbridge Island this is also an issue too, but transportation, because if folks can't get anywhere, it can be very isolating, right? And then after that, we were challenged to come up with what was called our 15% solution, considering that loneliness is such a big issue and it takes everybody to address it. Risa really challenged us to think, well, what is one small thing that you can do? What is your 15% solution that can maybe address 15% of the issue? And it was amazing. So we broke out into groups of 3, and we all came up with our solutions. And then we got to pair, in our groups, share ideas. Our group mates acted as consultants and gave us feedback on our solutions. And then we shared our solutions with the rest of the group. And we were then, as a wrap up, then kind of challenged, okay, well, please act on this. And we're currently working on a report on the workshop itself. So the planning committee. And my hope is that we actually survey folks. I'm a public health person. I love to survey folks, but that maybe in 6 months' time to see, did folks act on those solutions? So I'm sorry, that's kind of where this started and what the workshop, how it was organized.
Well, it sounds like that kind of hopeful response, and the idea of we're not going to solve it, but we can move toward solutions is a much easier hill to climb, I guess. So, Jason, you were a participant in this, and maybe you could share a little bit about how you experienced the workshop.
Absolutely. I mean, as Jessica said, it was an interactive event. I mean, it was kind of nice being able to go around during these breakout sessions where we're able to meet with people with different perspectives. I mean, again, housing providers, faith-based communities, community mental health. I mean, everyone had kind of a different perspective on things. I mean, one of the questions was, what are examples of social isolation, or what leads to social isolation? And it's just interesting hearing what people had to say about that, because everyone, depending on the lens that they're viewing things from, had something different. I mean, for ourselves, coming from an aging population, a lot of our focus was specifically around that, around well, sometimes seniors struggle with technology, and obviously in this day and age, we know that technology, social media are a big part of getting around social isolation, or I guess to some extent leads to it at times. I mean, ultimately, I mean, our mission within aging and long-term care, I mean, we are working independently through the community partnerships to promote well-being and independence of older adults and people with disabilities and caregivers. So a big part of what we do and our focus is around social isolation and making sure that, that people know what's out there, that people have the community resources, because as Jessica said, it affects a lot of aspects of life. I mean, it's a whole health issue. I mean, it's, mental health, financial, it's physical health. There's all these things that kind of go hand in hand with it. So, but yeah, ultimately a very good experience, good getting to know what other people are doing, hearing some pretty innovative ideas as well. So
That's because I'm curious about that. One of the things that I feel about our outreach here at the Senior Community Center is that it needs to be so um, personalized. In other words, there's no sort of, in our world we love, at least culturally, algorithmic solutions and some sort of you know product or service that you just kind of plug people in. And my experience here is that some people are going to not they're going to have to be invited in, and each person has a different sort of transportation challenge or reticence to ask for help, uh, don't want to depend on other people, um, might be embarrassed about something about their lives that they can get over once they start to hang out or meet people. But that first hurdle is a huge one. Any thoughts about that, either of you?
Jason, sorry, I like to talk a lot, so I'll try to be succinct. Yeah, to your point, Reed, so in public health, we have something called a social ecological model. So it addresses how there's so many layers of how we want to address behavior, right? So like you said, in the individual level, like your individual motivation, for example, to go to a social event, other people's willingness to talk with you. But I think in addition to folks, we have to be customized in the direct services we provide. I think as a society, we also have to destigmatize a lot, right? So I think as a society, do we honor everyone, or do we think less of folks if they have challenges with transportation and whatnot? Do we honor our older adults, our elders? Do we honor their knowledge? Because I think folks can feel really isolated if they know that they could be discriminated against or that their contributions are not valuable. So I think there's, as a society, the way that we treat each other, but the way that we also portray certain groups in the media as well. If certain groups are only portrayed a certain way and their value and their contributions to society aren't honored, then people might not feel as inclined to participate. So to your point, yes, and I think that's why it's so important that we also have very specific programming. Folks may feel safe at the senior center or with their cultural group, for example. So I think there's definitely value in that. And then there's also looking at the big picture of how can are there systems in place? So when we think about racism, sexism, how can we address that as a society? Are there policies that those of us in government can help promote? Like, for example, if we build a new community, can we make sure that they have a place to meet and gather? And it's not just about like the houses, for example. Can we make sure that there's access to transportation? And I emphasize that systems level issue because loneliness is not only about the individual, and I don't want to blame people for their loneliness. Yes, I do think that there's some folks who may choose or may be unable to go out and meet folks. They may have really valid, a lot of people have very valid and very real concerns about going out in public. And I think as a society, we can also help support them, like through the programming that you're doing about how we talk with folks and how we provide better supports.
Do you feel as though I could list many examples of people who were reticent to come, and then they found some sort of a group that was meeting here or doing something here that made a difference, and they didn't know that was what it was going to be like. So, that it's that hurdle. I'm imagining that one of the challenges in long-term care, Jason, is that people often feel like they're kind of warehoused, or it's like the world is now passing you by a little bit, and trying to figure out how to how to recognize that there are connections that we make all along in life that can sustain us. You mentioned a little bit about some of the innovative things that you heard. Anything that that comes to mind now that you might be willing to share as an idea of something that kind of surprises you about ways that people are addressing this issue?
My brain's kind of blanking on this one at the moment. I just remember there were a number of very good ideas. I'm really curious about the report with what some of these places are doing. I can just speak to some of the things that we are doing in terms of outreaching to community organizations and having our programs like our social connections phone calls where we started doing social check-in calls during the beginning of the pandemic because we recognized that social isolation was becoming a real serious issue. I mean, it had been prior, but it just got exacerbated by people having to spend more time at home for health related reasons. So and to echo Jessica's point too, I mean, it needs to be very person-centered. I mean, when I came from wraparound world, there was a saying is not about us without us is kind of what the saying how the saying went. And we need to be aware of these individual needs and what drives some people to social isolation or what impacts it the most and how can we address this on an individual level. And I think just not losing sight of that is extremely important. Individually tailoring services, supports, making sure that it's not just some cookie cutter approach to helping support people and making sure that they feel heard and understand and that they have those needs met. So
You mentioned this outreach program by phone. Is that volunteers that you work with on that, or?
So it's actually, so we have paid staff. So members of our senior information assistance team whose role primarily outside of those check-in calls is to work with seniors and help them identify what their needs are within with home, within the community, and supporting them that way. But so yeah, that's part of it. We also are aware of other organizations that provide similar services, other ways around social isolation. So we constantly have those in mind. Again, we are often outreaching to other organizations, trying to learn as much as we can to to provide people with those options. I mean, it might not always be us that would be a good fit. It's kind of like counseling for some people. I mean, there's just sometimes a better fit in some situations, but it is something we're kind of keeping our mind on.
We here at the Senior Community Center on Bainbridge call members on their birthday, just as a sort of a way to check in. And sometimes, I think sometimes that's nice. It's good, and it's low impact. It's not like I'm here to probe about what's going on with you, but it is an opportunity to make a connection. And as you were saying, I think, Jessica, even those what seem like minor things, reaching out, speaking to your neighbors, can have a larger impact than you might imagine.
Reed, if I can share, so Risa, our presenter, she did share a couple, she shared some examples of how other communities are addressing social connection. Something that I loved, and Jason, I don't know if you remember this, is the conversation bench. And there's initiatives across the world where folks will put these, they'll put a sign saying, conversation bench, I'm happy to talk. Because sometimes when you see someone sitting on a bench, you're not like, oh, well, that person want to talk to me, they want to be alone, or if they're on their phone, they're not. But having these benches designated as conversation benches, that can be a really good conversation starter. She also mentioned things like block parties and with aging. And I know our Jason's office also supports this, like Meals on Wheels, like also the services that you bring to folks' home in case they are unable to leave their home for whatever reason. As someone who works in government, there's also communities who address social connection in their community health improvement plans. So when I say a community health improvement plan, that's where different organizations, public health, healthcare, aging, social, like nonprofit organizations come together, look at data, and they identify what health issues are important in their community. Well, there's some communities that say social connection is really important. So they've identified goals for what they want to address and then activities. So here in Kitsap, for example, we have our own community health improvement plan called KCHIP, so Kitsap Community Health Priorities. And we have a bucket or a priority on mental health and substance use disorder. And as a next step from our workshop, we're going to be looking at what our next steps are, and can we, address this as part of our community health improvement planning. So it's not just a one event and then we're done. Some other things that communities do are, block parties. And what was great was there was a group of folks at the workshop that they came up with this bring it together Kitsap idea. And they're really excited about this, where they want to have an event every month that focuses on communities who've experienced loneliness in particular, like communities of color, older adults, immigrants, and having events honoring them at places across the county. And they're looking for partners. So other folks have thought about, doing more like, bringing books to children who live in subsidized housing. So there are so many ideas, based on the communities we serve, and doing these direct services, it's an amazing option. I also had the opportunity, along with Dr. Mark Hughes, he's the medical director of Kitsap Mental Health Services, to talk to the Kitsap Public Health Board. They're the governing board of our agency. We've got a rep from the city of Bainbridge Island. Council member Ashley Matthews, she's a Bainbridge Island rep. And we talked about this because also talking to our policymakers, hey, when they're planning a new community, make sure there's transportation, gathering spaces. When we're looking at other kinds of planning, making sure we think about social connection. So I think there are different examples of things, but yeah, there were a lot of examples. The YMCA during the event shared what they're doing about social connection. I think the library shared what they're doing. It's really amazing stuff. And then Kitsap Strong, our community impact initiative organization in Kitsap County, also shared. And there were a lot of folks who shared what they're doing for their communities.
Well,
It's
we just recently heard from the Bainbridge branch of the Kitsap Regional Library about their support for teens and tweens, and just making it a comfortable place to come and hang out with some supervision, but pretty much, an open space and support. If there are things that they need help with, they can ask. Otherwise, they can just play D&D or whatever for a little while after school. And I think those kinds of blend of both organized activities and informal options are really key. Yeah, I know that sometimes people will come here for a cup of coffee. They don't know anybody, and it can be not a very satisfying experience to show up somewhere and sit there and like everybody's doing their thing around you and you're not invited. So the other thing that we can all do to some degree is to look and say to somebody just, hi, how are you? Are you new here? Or do you, so that we're offering a bridge in informal ways. I'm wondering what the situation is in the county as far as aging and long-term care, Jason, about your awareness or lack of awareness about people who are isolated. It seems like one of our challenges is to try to think about how to reach out to the people we don't know if they're there.
Yeah, and this is something that's really on the top of our minds. I mean, we have an aging advisory council that's represented by seniors in different communities around Kitsap County, and so we are constantly getting impact. I mean, I know, Meals on Wheels Kitsap reaches a lot of people in rural areas, so that's something that we are cognizant about. I mean, not everyone's smack in the middle of Bremerton or Port Orchard. You look at people of different, race, ethnicity, socioeconomic status. It varies a lot in terms of just how they're isolated. So yeah, it is absolutely something that we are aware of and working towards. And we actually have our area plan too. So if you go onto our website, you can see Kitsap County's area plan and kind of what we're doing, how we're using the federal funds that we receive, and really where we're going, what the plans are going forward for the future.
I'm going to be interested to hear and also very happy to participate as the Senior Community Center in some of those 15% solutions. And obviously that's a starting point. Well, once we start to sort of see how those things are going, it looks like maybe the people who were part of the workshop are to some degree an incubator group to keep ideas going. We had a lovely talk here, unrelated, but I'm thinking, we need to do a better job of connecting the dots when we know that something's going on. I met with the Rotary and Island volunteer caregivers about the challenges with healthcare access And certainly, I mean, in this time of year, this year, we have a lot of people who are finding Medicare is all topsy-turvy because of some changes in insurers in our region. And great work by the state health insurance benefit advisors to hold a bunch of meetings and try to meet with folks up until the last minute of, I guess, December 6th. But that kind of navigation of the complicated systems are things that that can be isolating in themselves. I think we touched on earlier technology being a barrier, and our world becoming increasingly technological means that you kind of have to have a tech buddy if you're of a certain age, and that's another way that we can try to help as paid and volunteer folks. So I'm wondering if there are any thoughts that you'd like to leave with the people who are watching this about where we go from here, or sort of what we can all do. I think we've already talked about some just awareness of how much of an impact we might be able to have, but I just want to give you a chance if there's anything else you'd like to add.
Reed, I don't think any action is too small. And you know, it takes all of us. And if we can all do one small step, our own 15% solutions, we can really address things, right? And it's just one step at a time. And also, how can we create welcoming spaces? And we got the senior center, churches. And I love the idea of that bridge you mentioned, talking to folks. I also think, as someone who tends to be more of an introvert, if we can incorporate activities in addition to conversation, because I know with my 13-year-old, if a stranger were to come up to her and look at her in the eye, she would just not freak out, but if there was a game or an activity where, you know, you don't necessarily need eye contact immediately, but there's so many ideas out there. And what I would love to do, Reed, is send you information about the Surgeon General's report on loneliness, the Washington State report. There's so many ideas as well, but there's just so much we can do. And loneliness is not something to be ashamed of. It is not one's fault for being lonely. And it's something that as a community, we just need to destigmatize that and know that is a community responsibility and that we can all contribute to it, to solving it.
Great. Thank you both. Jason, any last thoughts?
Yeah, I mean, just reach out. I mean, let us know. I mean, you know, if you know of anyone that's experiencing social isolation, I mean, we like to give people any resource we can. So, I mean, this is something that we want to make sure people know exactly what is there. How can they get those needs met? So, reach out. Yeah, reach out to us, reach out to Jessica, reach out to each other.
Great. And if you want to send me, each of you, some of the links that you mentioned, your website, Jason, I'll be happy in the YouTube link to put the links down below in the description box for folks who are watching later. Thank you very much for your time and for your work. I think that it's I'm grateful for your wonderful examples for all of us.